The way we diagnose arthritis of the hip is to start with simple X-rays, a pelvis X-ray, as well as a couple different views of the actual affected hip. And what we're looking at is we're looking at the bony anatomy, and we're looking at if there's any narrowing of the joint space. X-rays just show bone, they don't show all of the soft tissues. That would be something like an MRI that would be needed to further dive into further detail there, but X-rays tell us a lot of information. So if there's joint space narrowing, we know at baseline there's some loss of the volume of the cartilage within the joint, which, if you recall, is by definition arthritis. So we'll look at X-rays, we'll look at the joint space, we'll see if there is still preservation of space or narrowing. Sometimes the diagnosis is easy. If you've heard of the term bone on bone, that is an X-ray term, and that is where there is no remaining space between the ball and the socket of the hip joint. At that point, we know there's advanced arthritis, and we can begin to talk about treatment options. Sometimes the X-ray findings are a little bit more subtle. There can be hardening of the bone, there can be bone spur formation, there can be bone cyst formation. These are signs of stress. It tells us at what stage the arthritis is, and also helps to guide your treatment. Sometimes if we feel that there's still preservation of joint space, but that the clinical symptoms warrant it, sometimes an MRI is necessary to further look and really look, if you will, under the microscope to see what's going on at the cartilage level.